Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. Today's example is a 1-year-old female and tired shepherd dog who presents following a presumed animal attack. Where she was found, they identified a large pool of blood. The presumed attack was to have taken place between 1 and 8 hours prior to presentation. Large wound defects are identified along the ventral neck. We observe that there is tracking of gas along the soft tissue planes. As we zoom in on that right lateral view, we notice that there is a defect in continuity of the ventral tracheal wall. Extending both cranially and caudally from this level, we observe gas tracking along the tracheal margins. As we track this gas further caudally, we observe that it extends into the cranial mediastinum, where we see slightly increased margination of several of the soft tissue structures within that space. Additionally, we see mild heterogeneity ventrally as well. On the ventrodorsal view, we appreciate that gas tracking along both sides of the neck. There is poor distinction of the vessels due to the extensive musculature of the neck. For this case, we have a strong suspicion of a ventral tracheal injury in the cranial to mid-cervical region. We also suspect that this might be contributing to the peritracheal gas opacities. This would raise the concern for a tracheal rupture. Multiple severe wound defects are also noted in the ventral cervical region, as well as a mild pneumomediastinum. The possibility of ventral heterogeneity can be due to tracking gas or accumulation of fluid in the mediastinum. Further evaluation of the trachea can be made with tracheoscopy, as this is more sensitive to evaluation of tracheal wall defects. We cannot comment on the potential for injuries of major blood vessels in the cervical region based on this exam. However, wound exploration can allow for further assessment. Be sure to check out the full report associated with this case. Thank you for listening, and remember, it's your case, so please post your questions on social media.